think ultimately what we need to do, we need to talk to Government of India, we need to convince them, and once the better norms are adopted, they have to follow it. It's as simple as that, or as difficult as that. I can see that. I can tell you very simple. They have a huge clout. 30 to 40% of the GDP is controlled by the telecom related companies. Most of the politicians are with them. That is why we have a huge 2G scam, 3G scam, which every day something or another comes up. And even in the many a times, they have some control, as one of the gentlemen did mention, that they have a control even on the media. Well, not all the media people can be controlled, okay? We do have some media people, so it is not that everybody can be controlled. It's not that everybody is corrupt in the ministry, but we just have started saying that every minister is corrupt. That is not true. Every telecom operator is not flaunting this or that. They are all following the rule. But the thing is, we always try to generalize. Let's not generalize the thing. Let's make a simple thing in the mind. Please. Sure. Sure. Any more questions?Ure. Definitely. So please, any more question for our COI people? Yes, please.
What are the norms for installing this white tower?
Norms for?
Norms. Laws क्या है मतलब उसके लिए? What are the norms for installing this mobile tower?
What are the norms for installing the mobile tower? I think maybe you can highlight that part. Yeah, just please pass on the mic, please.
Norms in terms of technical.
कितना दूर चाहिए, कैसे चाहिए, कितना हाइट पे चाहिए?
See, this is followed by respective local authorities. There are no such single norms governed by Government of India. No, basically, depending upon... Yeah.
Please give the mic.
When you need to set up a tower, firstly you have to establish the need to set up a tower. The need to set up a tower is based on a network plan कि भाई वहाँ पे अगर 200 सब्सक्राइबर हो गए उनको कवरेज नहीं मिल रहा है तो वहाँ टावर की जरूरत है. So it's based on a network planning requirement, right? Now after you decide to set up a tower, then there are various permissions that you need to take. You need to take, if it is near the airport or for example, so you have to take permissions from different agencies. For example,
don't want to install this mobile tower, but I want to remove this.
No.
Right. So one is for removing it. I mean, you have to have a legit reason for removing it.
For removing it.
Now, for removing it, there will be a contract which you've signed for installing it, right? And in that contract would be a variety of positions which are given. So you will need to get in touch with the tower company which has installed the tower, and then you sit across the table and decide, what you wish to do. That's the method, right? Okay.
Noise. Because the contract is for 10 years and it is one-sided contract, and the society has entered the contract because of the money, because the inducement you people give to the society people.
I beg, I don't think that's a nice word to use. So all that I will say, I think we had a conversation outside. We had a good discussion with you. I tried to explain to you on a one-to-one, so I don't think I'll dwell on it anymore. I've already explained it to you.
Have you got any studies about use of mobile phones in patients with permanent pacemakers?
No, I'm not aware of that. But what I know is that in case that anybody is concerned with a pacemaker and you don't want to use a mobile phone, you can, generally keep the distance between the pacemaker and yourself. But what I can tell you is that normally any medical instrument and a medical device, so all these work, or most different wireless devices have to go through a rigorous EMI, EMC testing. And then that is, they are only introduced into service, let us say, after that.
So as such, there are no studies?
No, maybe the doctor would be better positioned. What I can say is, my mobile phone, what is the are you an engineer?
No, I'm a doctor.
You're a doctor, right? So maybe hear from a doctor.
Sir, as I had told when I was speaking, ultimately it boils down to risk-benefit ratio. if the risk of using the phone by a pacemaker patient, if it is more than the benefit of using it, then you better don't use it. Who?
Using it. That is my question.
It's an electronic requirement, right?
Yeah.
So,
Attempt to answer that, in the case of a pacemaker, you are well advised not to keep the phone lying next to the pacemaker, as long as it is even this distance perfectly safe. But you are advised not to keep it. These are just like in a plane. There could be a possible interference. They say, why risk it? So, very clear advice: don't carry it in pocket. Don't keep it so close. This distance is fine. This is what I know. Oh, yeah, there are studies. There are studies. So these are from the handset manufacturers.
Thank you, sir.
सर, ये मोबाइल टावर्स फीड करने के बारे में मैंने यानी हमारे फोरम ने रूल्स के 13 और नगर विकास खाते के तरफ भेजे, तो अग्निशामक दल, तुम्हारा जिला प्रशासन, जिला स्थानीय स्वराज्य का, मनपा का जो कोई आयुक्त होगा या मनपा के कोई प्रेसिडेंट हो गए, उनका ना हरकत दाखला लेने को होना, पहले वो जाहिर करने को होना पेपर में, सब पब्लिसिटी करने का होना। दूसरी बात ऐसी, अगर ये रेडिएशन के बारे में कोई रोग पीड़ित हुआ तो उसका निराकरण करने का ही उन्होंने ना हरकत सर्टिफिकेट देने का होना, वो जाहिर करने का होना स्थानीय स्वराज्य संस्था को। इलेक्ट्रिसिटी बोर्ड का उसका कुछ नुकसान हुआ स्थानीय स्वराज्य अपने स्थानिक मालमत्ते का, वो भी उसका पैसा देने का। ये सब मेरे पास 13 रूल थे और नगर विकास खाते ने मान्य किया है। एक ही कागज मेरे पास अब भी है, इसलिए मैं सबको यानी दे नहीं सकता। अभी जेरॉक्स करना होना तो ले लो आप, हम अभी जाने वाले ही उधर, यानी साहब के हम इजाजत लेने वाले पहले कि क्या करने का, ऐसा हम आने वाले थे, साहब से हम सब बताने वाले। और नगर विकास खाते ने ये रूल्स तैयार किए साहब।
We'll discuss. बाद में हम लोग बात करते हैं।
हाँ, बाद में।
ठीक। Okay. Anybody else has any question? Yeah. Something quick.
Suppose there is congestion in the network.
Right.
Like New Year, Diwali.
Right.
So what happens? Do you increase the frequency or what is done?
No power is increased. Yes, sir.
It's not increased?
I can answer from my experience, but maybe not.
See, I'll just tell you basically what happens.
What I have been understood, people have told me that during vacations or Sundays, when there is not much of mobile phone use, the frequency is definitely brought down, and whenever there is a congestion, whenever there is too many subscribers are using it, it is increased. So I want to know, decrease is no problem, what about increase?
So basically what happens is, in a simple way, when you make a call, then the transmitter, base station has to transmit the signal back to you. So suppose instead of 10 people will call, it has to send signal to 10 people. If 100 people call, it has to send back to 100 people. But suppose now, if only one person calls, it doesn't have to send signal. So in fact, if we actually use less mobile phone, then even a base server will transmit back less signal. So in India, what is happening? We use mobile phone, in which, see, sometimes a good thing is associated with a bad thing. We have as I mentioned earlier, we have the cheapest rate per minute in the entire world. So what we do, we tend to use mobile phone for longer time. And if we use mobile phone for longer time, base station has to also communicate with you for longer time. So it is going to communicate, and that is why the answer to your question is yes, during the peak hour, the power transmitted by base station is very high, and during the off-peak period, power transmitted from the base station is very small. In fact, it varies by 10 times in a day.
Hello, sir. Excuse me, sir.
Yes.
Sir, in second session, sir will say from radiation, cell structure will be damaged. Is it proven?
Sorry?
Cell structure is damaged.
Cell structure is damaged.
Will be damaged from the radiation.
DNA damage and other thing, right?
Yeah.
Yes, actually speaking, there are lots of reports where they do mention, in fact, I also mentioned one slide, that it does damage the DNA. So it is not that it will not break. In fact, I had shown a slide where I had shown one a particular case where DNA was isolated, controlled manner, and then DNA which was exposed to X-ray.